Hello everybody, and I would like to present some cases of ultrasound in the setting of renal colic. And as you know, the utility of ultrasound in renal colic varies widely from place to place, and it depends on the risk factors of the patients and depends on what you are looking for. Most of the time in young patients, the diagnosis of renal colic is straightforward and you don't need emergency imaging, but sometimes it will help, especially if you are suspecting obstruction or other serious causes. This is an 18-year-old obese male with right side abdominal pain. He denied any vomiting or diarrhea and no urinary symptoms. Exam unremarkable. So he was discharged as constipation with laxatives. Unfortunately, he came back that his pain is not improving. Exam shows again soft and non-tender abdomen, and there was no obvious cause of his abdominal pain. So focused bedside ultrasound was done and shows dilated pelvic calyceal system of the right kidney, and there is hyperechoic shadow in his calyces. So this is mild to moderate hydronephrosis with right kidney stone. And it might indicate or it might be an indirect evidence of distal ureteric obstruction. Now, in the absence of any obvious cause of his abdominal pain, we treated the patient as renal colic with analgesia and referred for urology follow-up for re-evaluation. Second case is a 30-year-old lady with bilateral flank pain and anuria since morning. Her creatinine was 2 mg per deciliter. So we know this patient has acute renal failure, and now we don't know whether this patient should be evaluated by nephrology or urology. So ultrasound shows bilateral hydronephrosis, and at this time we know for sure that there is obstructive nephropathy. So we consulted urology, where they were very convinced to do CT, and CT shows bilateral ureteric stones, and she was referred for higher center for urologic intervention. Now, ultrasound here really shortened the duration of stay of the patient in the ER, and it gave us definitive answer in such case. The last case is 23-year-old male. He was referred from primary care as left renal colic, and his creatinine was 1.8 mg per deciliter. At the time of arrival, he was pain-free. His KUB shows probably there are some stones in his left kidney and distal ureter. So we conducted bedside ultrasound and shows clearly that the left kidney is swollen, and there are probably multiple stones with acoustic shadow here. Second view shows there are multiple hyperechoic areas indicating possibility of stones, and shows as well there is anechoic rim of area around the kidney here, just above the kidney and below the renal capsule, and this indicating extravasation of urine to the retroperitoneal space in the setting of obstruction. So then we look to the right kidney and we scan multiple times, and we failed to visualize the kidney. And we see here the liver. This is the vertebral shadow. We are supposed to see the kidney here, but really we failed and we could not see the kidney. It's obscured by bowel gas. So at this time we thought that this patient has significant pathology. He has some probably obstruction in the left ureter, and there is something in the right kidney going on. Either it is absent or there is some tumor or mass obscuring the right kidney. And at this time creatinine came 2.6. So as usual, we consulted urology, and their opinion is just to hydrate the patient and repeat renal function test after 3-4 hours to see. But we were questioning this answer, and we think this patient should go further for CTs because we are suspecting significant pathology there. So at the end, urology, they were convinced and they did CT, and here what we found. The left kidney is swollen, multiple stones, and there are also distal ureter stone with bladder stone as well. And the right kidney is not visualized. So here we know that this patient has solitary kidney and obstructive nephropathy. So at this time it is an emergency indication to relieve the obstruction, and the patient was referred to higher center for definitive management. Unfortunately, we had to break the bad news for the patient, and we told him that unfortunately you have only single left kidney. The patient was really surprised and told us that multiple times he had recurrent pain in his right side of the abdomen, and he was told to have stones in his right kidney. Is it really single kidney? We told him, unfortunately, yes. Thanks for watching.